of injuries today. So, for those of you who don't know me, my name is Swati. I'm a physiotherapist, and I do these videos to bring about patient awareness, just to explain you what's going on when you hear about a condition, a diagnosis, and to make you understand your symptoms a bit better. Okay, so if you're watching me on the live, could you comment so that I know that you're here and you're watching me? And if you're watching me on the replay, please comment hashtag replay so I know you've been here. And of course, if you have any comments or questions, do mention them in here. Okay, so if you like what I'm talking about at the end of this video, please go to my YouTube channel and I'll leave the link in the description below so you know where I am at in YouTube. And please subscribe, press the bell icon so that the next time I come live, YouTube does notify you. For those on Instagram, for those of you who are watching me on Instagram, please follow the link in my bio and you can get to my YouTube from there. Okay, so today's topic, let's get on to rotator cuff injuries. Now, what is rotator cuff? Okay, so you might have heard of the term rotator cuff, you might have been diagnosed with one, or you might have heard of a sports person or a friend or family member who's had a rotator cuff injury. So, rotator cuff is basically a set of four muscles. So, these muscles, they have an attachment to your shoulder blade, so the wings, as some people call it, and they come and insert or attach onto the upper part of your arm bone. So basically, they are running on the uh, they're running between the shoulder blade and your arm, and they are very important for most of the arm movements, but especially for the sidewards movement and for the rotation movements. Okay, so what happens? How do you get this injury? So it can either be that you've injured the rotator cuff muscles, this group of muscles, either by a fall. So you've basically fallen sideways, or you've had a contact sports injury where somebody's come and banged into you and hurt the tendon there, and or else it can also be from degeneration, a wear and tear that you've had with age, and then there is wear and tear in the tendons itself. Tendon is basically a part of the muscle there, so there's wear and tear, and so that area has undergone some tears. Now I'll talk about the tears in a bit. So another thing that predisposes you to rotator cuff injuries is smoking, and if you've had repeated steroid injections given into your shoulder. So that could be cause of your frozen shoulder or any other reason. If you've had repeated steroid injuries, it tends to smoking and repeated steroid injections tend to weaken your rotator cuff muscles, the muscles that come and attach onto the upper arm here. Also, those who are in construction work, so they are repeatedly doing more overhead sort of activities where they are carrying heavy weights and doing repeated activities, can also be prone to rotator cuff injuries. Now, depending on how bad is the injury, you can either have just a strain on the rotator cuff, or you can have a tear. Now, your tear can be just a few fibers or partial thickness. So it could be like doctor might say you have a 20%, 50%, whatever tear, or he can say it's a full thickness tear. That means it's like a through and through tear in the muscle. So obviously for the full thickness tears, you would have to go undergo surgery. But the rest of them, the strain and the partial thickness, depending on how much is the partial thickness tear, you can make do with physiotherapy and exercises. Okay, so just looking at my notes here. Yeah, I think we covered everything there. Yeah. So talking about the symptoms, you will feel a dull ache in deep inside your shoulder, right? If you're sleeping on the injured side, you will feel the pain. So basically, you won't be able to put that pressure onto that shoulder. And even if you can, once you get up, you will feel the pain, in that deep, achy pain inside your shoulder. And if it's an acute injury, then you might feel sharp pain as well. Now, you will have a problem with overhead activities again. So, like combing your hair, or if you are playing baseball or cricket and you throwing the ball overhead, or racket sports like tennis where you're doing overhead throws, or swimming like freestyle when you take your hand up all the way. So these can be quite painful for you. Also, a painful arc may be present. What is a painful arc is basically if you are trying to raise your arms sideways here. So what happens is between this, if this is 90, between 70 to 120 degrees of raising your arm, you will feel a sharp pinching pain in your shoulder joint, right? So a painful arc may or may not be present, not always. Okay. And obviously, you'll have pain at the attachment side of those rotator cuff muscles. You can have muscle weakness when you move your arm around. You can have, like, those little clicks that you hear in the arm. So you can have those clicks or those grating sort of a sound, like the bone rubbing on bone sort of a sound coming from the shoulder, plus minus pain. So it might be painful, it may be painless, but this is one of the symptoms you can see with the rotator cuff injuries. Okay. Uh, Now, how do you diagnose this? Your doctor will obviously ask, your doctor or your physiotherapist will obviously ask you what are your symptoms, and then they will run you through a few tests. MRI will confirm the diagnosis. So basically, doctor will send you for MRI because they will need to know how much is the tear within the muscle. And if it's not a tear, then is it just a sprain? Does it have any associated injuries with it? Do you have a bursitis in the area, etc., etc.? So yeah, that was it for rotator cuff injuries. The next time we are going to talk about impingement of the shoulder, which is sort of related to your rotator cuff injuries. So this is a part of our series that I've been doing on the shoulder. If you are interested in more shoulder injuries, you can go back and look at the frozen shoulder, acromioclavicular joint, like the AC joint here. The tip of the shoulder is painful. You can look at those videos from before. You can look them up on my YouTube. And if you like what I'm talking about, feel free to join my Facebook group. It's a free group, and we talk about similar topics, and we do a lot of series there. Like we did one on low back pain, we did one on posture, one on hydration. So there's a lot going on in that group. So if you like what I'm talking about, do pop into the group and have a look at what's going on. I will leave a link in the description for those who are watching me on IG, on Instagram. The link, it says my community, and it's in the bio. You can take it, on from there. Alrighty. So I hope you all have a good day or night, depending on where you are. And I'll see you guys next time then.